What exactly is chiropractic for people that don't know or might just be tuning in?
Well, chiropractic is a separate and distinct medical field, if you will, that is based on the spine and how the nervous system functions from the brain all the way down to the bottom of the spine and all the nerves that come off. What we specialize in is called neuromusculoskeletal diseases, and that is a fancy way of just saying anything involving the nerves and muscles or the skeleton. We go in and find out where the misalignments are, the mechanical misalignments are, and realign the spine through adjustments and through exercise, in some cases teaching people about nutrition, and get the spine to realign and allow the body to heal.
Now, if someone's never seen a chiropractor, how do you determine where these misalignments are in the spine? What methods do you use?
The first thing that we do in our office is we go through a very thorough case history in order to find out if they're going to be a chiropractic case. The next thing we do is a very thorough neuro examination, checking the nerves. The orthopedics, we check all the ranges of motion of the body, the neck, the spine. And then if we're finding positive findings, we move on and do our x-ray analysis. And we take all of our x-rays seated, which is kind of different for a lot of people. They're used to either standing up or laying down to take x-rays. The reason we take them seated is because the spine is under its greatest load when it's sitting. So by taking the x-rays in the seated position, we can see the spine when it's at its most stress. Then we do a very thorough analysis of the spine on the x-rays, which can take probably about an hour and a half for me to sit down and draw all the lines. There's over 150 lines we're drawing on our films to analyze where the misalignments are and where we can apply forces to correct the misalignments, and what muscles we have to do work to get them to correct.
Once you determine where the misalignments are, can you literally get someone out of pain that day and on the road to wellness?
Well, it depends upon how long they've been in pain. Some people, it's always amazed me that some people that come in that have been in pain for 10, 15 years, you can adjust them once or twice and they're out of pain, while somebody else just had a minor fall and they're in a lot of pain, and it might take you as much as a week or 2 weeks to get them out of pain. But for the most part, it will run at least 2 or 3, maybe 2 weeks of adjustments before you get somebody out of pain, and gradually they improve. So everybody's a little bit different.